right. Good afternoon, everyone. Before I begin, I want to acknowledge and thank the leaders who are with us here today. Of course, Public Health Commissioner Dr. Allison Arwady, our Department of Family and Support Services Commissioner Lisa Morrison Butler, as well as Nellie Vasquez Rowland, President and co-founder of A Safe Haven, and Dr. Thomas Huguet of the Lawndale Christian Health Center. Thank you all for being here with us today. Both organizations have been absolutely vital community partners in addressing the needs of Chicago's most vulnerable families and residents. I'd also like to give a special thanks to Dr. David Ansel from Rush University Medical Center, who's been at the forefront of this crisis. And Rush University has really done a tremendous job. Throughout the COVID crisis, we have focused the full power of our city around ensuring the health and safety of our residents as we work to bend the curve of the disease's spread. Our efforts have been particularly focused on our residents who are most vulnerable to this disease and on the broader impact on social services and supports. Residents who struggle with pre-existing conditions, who do not have the means to withstand the loss of a job, or due to their living circumstances, who struggle to maintain safe levels of social distancing. This is particularly true of our residents experiencing homelessness. Residents who, like many of us, simply cannot close their doors to this virus. It's for that reason that we have rapidly escalated the establishment of a citywide system to prevent transmission of this disease within shelters and encampments, all in an effort to decompress congregate settings, allow for social distancing, and to save lives. This effort has required the unprecedented mobilization of our city workforce in collaboration with medical providers, shelter operators, and advocacy organizations, centering on both prevention and response. 3 weeks ago, we announced our partnership with the YMCA of Metro Chicago to fill a critical need in our city's shelter capacity by opening space in YMCA locations across Chicago to allow for decompression of existing shelters and proper social distancing across our systems of care. Since then, we have continued to build on those efforts through an additional partnership with the Salvation Army to open temporary shelter spaces with a total of 699 beds, including facilities dedicated to women and children. We've also mobilized Chicago's medical professionals to assist shelters and healthcare workers with symptom screening. We've distributed more than 25,000 pieces of personal protective equipment, or PPEs as they've become known, to shelter residents and staff, as well as to DFSS outreach teams in partnership with Rush Medical Center and Project Hope. We've had DFSS teams continually visiting encampments to ensure safety and nutrition and respond to other needs. We've installed portable washrooms and hand washing stations in large encampments. We are working with our shelter partners to have nurses visit all of our city shelters and provide in-person education, as well as pairing community-based providers with local shelters for ongoing clinical support. I also want to give a special thanks to Lawndale Christian Health Center for their partnership in providing housing to other high-risk individuals, such as the elderly and those with underlying medical conditions. To date, they have moved over 100 people out of congregate settings and into individual rooms with support services where they can be safe. Nonetheless, despite all these efforts, there continues to be a risk of exposure every day for people living in congregate settings. And it is critical that we continue to monitor and rapidly respond to cases as they arise. With help from U of I Health and Rush Medical Center, I am proud to announce that we've extended our testing capabilities and will now be able to perform more tests of shelter residents and staff each week. If people are diagnosed with COVID-19, it is imperative that they are rapidly removed from these congregate settings. That's why I'm also proud to announce that through a partnership with A Safe Haven, Rush University Medical Center, and Heartland Alliance, we've opened a 100-bed isolation facility with wraparound services for individuals already in our shelters who require additional support for mental health and substance abuse needs. and we are now looking to expand on this model to meet our citywide demand. The end of this crisis may just be a speck at the end of a tunnel right now, but it's through measures like these that we will be able to make that light eventually shine brighter. While no one is immune from this disease, what we have seen all too clearly are the chasms in our society when it comes to those who are vulnerable. They were in need before this crisis, and they are more in need now, and we have to respond continuously to fill the void and address the need for our vulnerable populations. All of this serves as a wake-up call to our city on the life and death importance of closing the gaps in equity and opportunity, particularly when it comes to poverty, housing insecurity, and other issues that make people vulnerable. We've got to tackle those head on. The work that we're doing now is building a foundation and an infrastructure on which we will be able to address these issues in the long term. And I'm grateful for the partnership that we have seen from people all across the city. It's really remarkable of how people are coming together and stepping up to fill a need at this time. Now, with that, I'd like to welcome our Public Health Commissioner, Dr. Allison Arwady, to the podium to say a few words. Doctor?
Thank you, Mayor. So obviously, a stay-at-home order assumes that people have a home to stay in. And from the beginning of this crisis, folks at the Chicago Department of Public Health, with so many partners across this city, have been calling out to make sure that we do not forget the people who don't have a home to be able to stay in at all. Here's what we know about COVID-19. It spreads through close contact, especially among people who live together and may not be able to maintain social distancing. It can be hard to detect because some people with COVID-19 have mild symptoms or perhaps none at all. And it's particularly dangerous for people who are older or have underlying medical conditions. All of this means that from the beginning, we knew that people living in homeless shelters would be at especially high risk. We knew COVID-19 could spread quickly and undetected among people like this who are among our most vulnerable. Way back in January, when Chicago had had one case of coronavirus, we already had more than 100 people working across the city to figure out housing solutions. Initially, we had to make sure we had places for isolation and quarantine for travelers coming in through O'Hare who might not be able to continue their travel. The health department does not normally provide housing, although we work with a lot of partners and certainly pushing permanent supportive housing for people who are unstably housed has been a long-term priority. But from that work, we continued building to make sure that we would do everything we were able to do as a city to meet this challenge. Stopping an outbreak of COVID-19 among Chicago's homeless population has absolutely been one of the most challenging aspects of this response. We are not done. We have a lot of cases already, and we are working very hard to limit the spread in all of the situations where we can. I think some of the really innovative work, like the partnership with Lawndale Christian, where we are moving individuals into one of the hotels that the city secured, not when they are already sick and need to be isolated, but because they fall into that high-risk category, people who are over 60, people who have underlying health conditions. We know that even though we're doing the best we can to socially distance, we've done a lot of work to spread out populations and look for ill individuals. We said the right thing to do is to take these high-risk folks and give them a safe place to be. We'll see how long that needs to continue, but we have not put a time frame on it. We're really making sure that together we're doing what we can to protect the most vulnerable residents. Thinking about congregate settings, things like the homeless population, things like people who are living in long-term care facilities or nursing homes, people who live at baseline with a lot of other vulnerable people and may not be able to always have that social distancing. Working to make sure we do everything we can to keep those people safe is one of the things that keeps me up at night and keeps the people at the Chicago Department of Public Health pushing the hardest. I think we've learned a lot already about how to adjust models. Certainly our partners have been absolutely instrumental in terms of making sure that we adjusted where we needed to, and we will continue to make those adjustments. For example, just this week, CDPH has now arranged with partners for nurse visits in all of the shelters across the city to make sure that we're providing in-person education and screenings. There's much more testing that's happening. We're bringing on some of the newer forms of testing to really understand how those can work in these populations, and it's been an ongoing effort that is long from over. The West Side Homeless COVID Response Group, led by Dr. Stephen Rothschild, who is a member of Chicago's Board of Health, has been organizing with the same goal, has been preparing as we have from the beginning to really support people experiencing homelessness. And as we think about a citywide strategy, it's these organizations and many like them who you'll hear details from shortly, but they're really on the front lines, providing the critical housing, not just the reactive response, but the preventive response. We thank partners who are making testing available. We especially thank the people who are working right now every day in these shelters, making sure that we're doing the best job that we can to support not just the residents, but the other people who work in the shelters, working to keep people safe, working to make sure people are supported. We won't be able to prevent every case, but I'm really proud of the work that our city has done together to protect people experiencing homelessness. Public health emergency, as the mayor said, it magnifies what we already know. Health requires a home. And the holes that our social safety net have had have real impact on health outcomes. We're seeing those clearly because of COVID, but they've always been there. And I hope that we learn from this moment as a city about how to build a more equitable, compassionate system of permanent housing and ongoing care for the people who need these basic supports most. And with that, I'm really pleased to turn it over to Commissioner Lisa Morrison-Butler from the Department of Family and Support Services, who's really been leading the effort on this.
Thank you, Dr. Arwady, for your leadership and your partnership. My name is Lisa Morrison-Butler, and I'm Commissioner for the Chicago Department of Family and Support Services. From the start of this crisis, the Chicago Department of Family and Support Services has made the well-being of residents in shelters and in encampments a top priority. Working with Mayor Lightfoot, the Department of Public Health, and our community-based organizations, we are focused on meeting the needs of homeless residents as quickly, efficiently, and humanely as possible. As the mayor has said many times, the city is taking an all-hands-on-deck approach to containing the spread of COVID-19 in shelters. And as the response to COVID-19 has evolved, so have the needs of residents experiencing homelessness. You may already know that the Department of Family and Support Services Division, Homeless Services Division funds 3,000 of the 4,000 shelter beds in the city. In order to embrace social distancing in the homeless shelters that we fund, DFSS reconfigured congregate shelter settings by directing our shelter partners to embrace the distancing guidelines and to space beds at least 6 feet apart. This decompression resulted in a decision to move shelter beds from the existing system into alternate sites in order to achieve the desired spacing, ensuring safer shelter capacity for families, youth, single individuals, and returning citizens. In addition to our work with our shelter partners, the DFSS Homeless Outreach Team continues to canvass the encampments around the city in order to assess the need for resources, identify residents in encampments that are at higher risk, and to strongly encourage those encampment residents to consider shelter. Our outreach efforts are not confined, however, to our own team, but they also include multiple DFSS-funded agencies that provide wraparound services for unsheltered residents all year long. We are collaborating with CDPH, All Chicago, and the Chicago Continuum of Care to provide ongoing resources and training to homeless shelter operators and other homeless service providers to ensure they are practicing the necessary precautions to help reduce the spread of COVID-19 amongst our city's homeless population. Partnerships like the ones we are acknowledging today with A Safe Haven and Lawndale Christian, as well as partnerships that you've heard us speak about before, like the ones with the YMCA and the Salvation Army and others, allow us to expand our reach and offer more and better supports to individuals battling both homelessness and the coronavirus pandemic. From meeting transportation needs, hiring shelter staff, equipping shelters with food and necessities, to keeping the alternate spaces clean, the collaboration between city departments and the expanded relationship with social service agencies provide the framework through which we seek to respond to the needs of our homeless residents during the pandemic. I cannot thank enough our community-based organization partners for the way that they have responded to our calls for help. The nonprofit sector is the sector of our economy with the slimmest margins. These organizations are not flush with cash, and yet it is these very organizations that have stepped up and done so quickly and with a fierce passion and commitment. They are literally making miracles happen every day, and they are doing so in large part behind the scenes and unnoticed. My deepest gratitude and respect goes out to each and every one of them. As always, let me remind Chicagoans that residents can make a request for shelter by calling City Services at 311. Also, let me end by thanking Mayor Lightfoot for her unwavering leadership during this unprecedented time and for keeping all of us focused on our mission to ensure the health and safety of every Chicagoan. And with that, I will bring up Dr. Thomas Huguet. Is that correct, sir?
Huguet.
Huguet. All right. Thank you.
Good afternoon. My name is Thomas Huguet. I'm a family doctor and medical director for mobile health for Lawndale Christian Health Center, federally qualified community health center on the west side of Chicago. Thank you, Mayor and Commissioners, for this opportunity, and nice to see you, Nellie. I am very privileged to work with a great team of folks who serve folks living in homeless shelter sites and continue to serve in homeless shelter sites on the west side of Chicago. We currently serve 13 sites. Over the last 24 years that I have done this work with this great team, we've really been able to really bring healthcare to where it's needed for people experiencing homelessness, including the provision of medication-assisted treatment for those suffering from opioid use disorder. We also do quite a bit for serving mental health needs, including use of long-acting injectables in the shelter site. We also do quite a bit of social service support. So we are really on the ground seeing patients from day to day. Of course, with this coronavirus pandemic, what we've had to do has changed a little bit, and with our great partners that are here today, we've really been able to do a little bit more. And for the last 12 days, we've been able to take care of people not only who have coronavirus or COVID-19 disease, but also those who are most at risk, who are in shelters. We're welcoming our 115th person this morning into the hotel to try to keep them safe. We really are sheltering those folks who are high risk and taking them out of large congregate settings. Now, some people said, well, how is that going to work if you're having folks coming from a large congregate setting experiencing homelessness into a hotel? Many of the people who said that may not have a lot of experience working with folks experiencing homelessness. But I can tell you, Mayor and Commissioners, that the folks that we're serving in the hotels are doing great and probably even doing better than they were doing before. When I visit my patients in the hotel, their medicines are all lined up neatly. Their shirts are all lined up neatly. I had one patient 2 days ago ask me for a broom and a dustpan because he wanted to clean up his hotel room. This really shows that there is a sense of ownership within the hotel room. Some people were worried about the hotel rooms, but I can tell you that people really want to be in a safe, secure place, and that they're willing to really keep it up. The other thing, another patient told me when we were working with one of the largest congregate shelters in the city of Chicago, Pacific Garden Mission, we were getting some of those high-risk people ready to come to the hotel. And he was sitting on a concrete step in the sun, waiting for transportation. And he said to me, well, what if I test negative? I don't want to come back to the shelter. I know there's coronavirus in the shelter. What am I supposed to do? And I'm so glad that the commissioner and so many other partners really are trying to work very hard to try to give folks an option for permanent supportive housing. We know that that works. We know folks who are experiencing mental illness and opioid use disorder, they just do so much better if they have proper, safe, supportive housing, just like the rest of us would. So I'm very, very glad to hear that this effort is moving forward, and we really hope that we'll continue this. Mayor, commissioners, we love our patients. We love our city, and we would love to have a safe, secure, supportive place for our patients who are experiencing homelessness. And with that, I'm pleased to introduce Nellie Vasquez-Rowland, President and co-founder of A Safe Haven.
Good afternoon. My name is Nellie Vasquez-Rowland, and I am the president and co-founder of A Safe Haven Foundation. Since 1994, A Safe Haven has been on the front lines of homelessness. We provide one of the most complete and comprehensive solutions to addressing the underlying issues related to poverty and homelessness, as well as advocating for relevant policy issues on the topics of criminal justice reform, mental parity, the opioid epidemic, and now COVID-19 pandemic. We also provide phased housing approach with a multidisciplinary team of professionals that include individualized assessment, physical, education, workforce, housing needs for our residents. These wraparound services are designed to meet the underlying issues of individuals' needs and provide them with the coordinated care services they need to foster good health, social, economic, and housing stability for themselves and for their families. Thankfully, the vast majority of the people that we serve at A Safe Haven have succeeded in recovery, family reunification, employment, permanent and stable housing. Every year we serve over 5,000 people a year. Our network of transitional, supportive, affordable senior and veteran housing provides people with the level of housing and the level of care that they need based on where they are in life. And I call our work at A Safe Haven truly an elegant solution to a very complex issue. We are proud to be among a network of top-notch leaders in the field who are doing good work on behalf of our most vulnerable populations, many of whom are in this room. I want to thank Mayor Lightfoot for your leadership, your steadfast leadership during this unprecedented time in the pandemic crisis. We've never seen anything like this in our history. For the first time, in our city, we're seeing the issue of homelessness being dealt with on the level of urgency that recognizes it not as just a moral or financial imperative, but truly as a public health imperative for the first time. We are acknowledging how, as a nation, health and wellness of this vulnerable population is truly interlocked with our own. Today, what is happening on the front lines is truly transformative and is uniting the expertise of all the community subject matter experts working on this issue together and as one. In response to COVID-19, I am pleased to finally see the convergence of institutional healthcare experts, homeless experts, and government agencies. We are now working together to create the intentional integration of institutional healthcare with homeless and behavioral healthcare providers. We are now working side by side to provide the homeless with a seamless access to the appropriate level of care, housing, and discharge strategies that will no longer land them back on the streets. I know after this, there will be no going back to the old way of doing business. Our community-based residential behavioral health care solution, once overlooked by many, is now becoming a critical part of the emergency response infrastructure. It will create a new norm which will give the homeless access to the dignity and level of care they need. It will help prevent and overcome any of their sudden or chronic health, behavioral health, and economic and housing crisis situations. It is under Mayor Lightfoot's steadfast leadership that we are honored to be a part of and be a resource for this new delivery system. We could not have done this without the collaboration and support of the leadership from the Department of Health, Dr. Awadi, in particular Megan Cunningham, who's truly been a blessing. I think I speak for everyone when we say that she's been a blessing for the entire network for both health and homeless providers in listening and offering guidance and support in a way that relies on the true experts that have been doing this. I want to thank the leadership at OEMC and the Department of Family and Support Services, Lisa Morrison-Butler, for the role that you are playing to support the collective network of COVID-19 responders, first responders. I met with Dr. David Ansel almost 30 days ago, and we had the conversation of what it would look like to create an isolation space at a safe haven, to augment the work that we were already doing on the front lines by converging our healthcare services with our behavioral health care services. And within 30 days, we're really proud to say that we now have the city's first isolation space dedicated to serving the health and behavioral health care needs of the homeless. We could not have done it without the support of Angela Moss, the Director of Nursing, and Dr. Stephen Rothschild from Rush University Medical Center for their leadership and their vision and helping us create the first, again, isolation space. This initiative will truly help the homeless simultaneously overcome the comorbidity of their health and behavioral health care challenges under our respective teams as they convalesce following their positive diagnosis. This is a pivotal time. This is an extremely difficult time for all of us. But rest assured, the hard work is being done, and this is the dawn of a new era for community-based healthcare, and we look forward to becoming a part of the elegant solution that emerges that will endure for the benefit of all stakeholders. Thank you, and God bless.
Now we're happy to take, let's do on-topic questions first, because I have a understanding that there may be more questions beyond
There are
today.
many, more questions. On topic, no one has submitted an on-topic question to me. Please, good, thank you.
On-topic question from Bill Cameron. What is the current official estimate of the number of homeless in Chicago?
Oh, I yield the floor.
There are a number of different metrics that we track. And so, for example, there is a thing called the point-in-time count, which is required by HUD if you accept federal funding. That is a count that takes place in January of every year. It's just one night, and it counts people who are either on the street or in shelters. That number last year was a little under 7,000, and we are still tabulating the one from January of this year. That is only one number, however. It is estimated by our friends at the Chicago Coalition for the Homeless that if you include people who are unstably housed, you can get a number many, many times that amount. And so I have heard from CCH numbers like 80,000 or better if you include people that are unstably housed, meaning they're couch surfing.
Any other on-topic questions? Okay. Let it rip, Dana.
Okay, first question, this is a solo subject, and then I have a list of questions that are all related. Regarding CPS remote learning, which officially is underway today,
Right.
You'd mentioned, CPS had mentioned, 3 weeks ago, that there was going to be a push to get more than 100,000 tablets and devices out to kids. So how many tablets and devices has the city, CPS, given out thus far, and how do you find those so-called lost kids who might have sort of disappeared into thin air over the last few weeks?
Well, I don't think they've disappeared. CPS knew from day one of the closure that we needed to place particular emphasis on those children who were homeless. And so there's been, I think, a significant effort made to make sure that they're connected, both through teachers, but also counselors and school administrators. In addition, I can't give you a precise number of what's been handed out so far, but we can get that to you. I just don't have it offhand. But I know over these last couple weeks since we announced remote learning that there's been a huge effort, and I have to give thanks to the number of people who have also stepped up and volunteered by the tens of thousands of additional devices to make sure that every student that needs one is getting one. In addition, there's also other work that's been done with the various service providers to address the fact that there's not connectivity in every house. So CPS IT's team and the leadership have been really working to shrink the digital divide as much as possible so that our children really have the ability to connect up with teachers and counselors and others through this extended period of remote learning.
Okay. And now I have a series of questions about this Hilco smokestack situation. Number one, do you believe the Inspector General is needed to investigate the situation? Many aldermen are now calling for one. And what type of cleanup might the company be responsible for, and fine might the company face?
All right, so that, I think, are three questions. If the aldermen want to have the Inspector General engaged, have at it. But I'm not going to wait for an Inspector General report. We started our work literally on Saturday, worked all through the weekend, and that work is ongoing. It's my hope that we're going to have at least a preliminary amount of information that we'll be able to put out in a fulsome way to the public later this week. But if the aldermen want to call for an Inspector General investigation, that is certainly their right.
Why did the city not listen to warnings from community leaders, many of whom were begging for this implosion not to happen, especially now during COVID-19, and why didn't you stop it?
Well, I'm not sure that that's accurate. The local alderman was very much engaged in this, about 10 days out or longer, talked a lot to the various departments that were involved, CDPH, buildings, as well as, my understanding is he had a lot of direct contact with the CEO of Hilco. All of us were assured that there was a very specific plan, that there would be water on site, and that they would be using the water before, during, and after to make sure that a dust cloud didn't migrate off-site. Obviously, that didn't happen. My understanding is Hilco has now acknowledged that they did not follow the plan that they had been told us, and I think told the aldermen. If we had known, obviously, that they weren't going to do what they said they were going to do, we wouldn't have allowed this to go forward. But that's part of the details that we need to dig into.
With that, do you believe residents should have been given far more warnings?
My understanding is that both the contractor and the local alderman did give a heads up to nearby residents in advance of Saturday morning. But again, we're going to make sure that we understand all of those details.
Hilco says it did abatement testing before the Little Village demolition, as you just discussed, and showed no presence of asbestos or lead in the smokestack. Have you seen those actual reports? Is that what the reports state? And will you release those reports?
I think Dr. already has some more specifics on that question.
I do. So obviously the team at the Chicago Department of Public Health has been going over all of the details of this project, and particularly things where there were assurances made. But in the case of the asbestos, there are very detailed reports that go down, show really the asbestos removal was completed over 18 months. It was completed on November 30, 2019 in that main part of the building. There was an incidental building that was finished on March 31st that was not the part that, where this implosion occurred, and there is nothing in these reports at this time that is suggestive that asbestos would have been a problem. That said, obviously, we're collecting additional information, including some of those samples that were taken on site, just to, make sure that, again, everything was done appropriately. But I think asbestos is one of the areas where we have good information and details about the work that was done.
So the department was monitoring
Yes.
this on a weekly basis?
Yes.
Okay, and this is wording from a colleague. If that was in fact the case, obviously you're still looking into this, but why did Little Village look like a local version of Chernobyl after the demolition? Can you explain?
Sure.
You know, I appreciate the hyperbole, but I really don't think that that's appropriate in this time. People have fear because of COVID-19, period. And I really have to say it's a bit offensive for somebody in the media to make light of a circumstance like this. This isn't Chernobyl. I mean, and again, to go back to what that devastation that did to that community at that time and continues to be an ongoing circumstance, really, really poor choice of words. You didn't give the name of your colleague who made that quip, but I don't think anybody on this side of the podium and the people in that community appreciate anybody making such light of the circumstances that happen. What we've said from the very beginning is the representations that were made by Hillco were not followed through on. If anybody in the city government or the alderman's office knew that what was represented to us wasn't actually going to be followed on site, we would have stopped it in its tracks. But assurances were made, promises were made. Those promises were not kept. And that's the focus of the investigation. But again, it's really not helpful to use that kind of offhand language in talking about what is obviously a very serious issue in the middle of a pandemic that has only added to the anxiety that people in that community are already experiencing.
Regarding cleanup, number one, there's a call for more masks per household in the Little Village community,
Yes,
number
we're aware of
one.
that.
And, you know, is that going to happen? Is there anything underway to facilitate that? And number two, along the lines of cleanup, how should residents safely clean up their homes since there are so many unanswered?
So regarding the mask, Alderman Rodriguez reached out to me personally this morning. I had some follow-up questions for him, and as I walked into this press conference, I was waiting to get a response back to those follow-up questions. But we're obviously going to do everything we can to meet the needs of the residents. The cleanup really started on Saturday and Sunday and is ongoing. My understanding is street sweepers went out on both days, on Saturday and Sunday. We know that my understanding is that Hillco is actually sending a team of people out today to go literally door to door to assess what the damages are. I made it very clear to the CEO of Hillco when I spoke to him. They own this, and they have to mitigate the harm that has been done to residents and residents' property. So once we have an accounting for the extent of the damage, we'll be in a better position to better understand what the mitigation efforts are going to be made. But as I said, I want cars cleaned, I want streets swept, I want houses to be cleaned of the dust that's settled. So that is the charge that I've given to my team, and Hillco is going to have to own responsibility for that.
Can I circle back? I just got a question from somebody who knows a man who worked at the facility.
So can you tell us who the questions are coming from?
This one, I'm happy to do that. This one is, I honestly don't know. It's someone who has my text number, and I can find out.
Okay. Well, I just meant if you've been giving us questions from people in the media. Normally, the cadence is you identify who the person is.
Oh, okay. I'm happy to do that going forward. From a gentleman who worked at the facility, I think you touched on this, Dr. Arwady. Did they clean those stacks prior to demolition? Because, you know, obviously they are filled, according to this person, potentially with toxic ash. Do we know if they were indeed cleaned before the demolition?
Yeah, so what I can say is that always as part of demolition procedures, there are obviously a lot of health pieces that come into that, and that is part of what CDPH helps monitor in conjunction with the Illinois EPA. And so there, you know, for example, the asbestos work, right? That's something that is known to be potential harm for human health, and especially where you have the friable asbestos, as opposed to the asbestos that can be coating metal, for example. You have to make sure that all of that is removed, and all of that was removed to the very best of our knowledge. Like I said, we're looking over it. Separately, there were other tests regarding lead that were done by the Illinois EPA that, again, the team is looking through the details of. But as far as the major causes or the contaminants that we would think would be of significant impact to human health per our regulations, that had all been done appropriately with the appropriate testing. Everything is being reviewed, of course, in the setting of this most recent event.
Okay, this question, Mayor, is from Kate Chappelle at Channel 5, at NBC 5. There's a planned lawsuit by several residents and an attorney against the city and contractor. Your response to that?
I don't speculate about litigation that might come, and I never talk about litigation that's pending.
No.
Okay. Mayor, a
Yes.
question from Fran Spielman at the Sun-Times. Do you believe the residents of the area should receive financial reparations at the very least and periodic health testing to see whether there were any negative ramifications of what happened?
Well, as I said previously, we're still assessing what the extent of the damage that was done, and we'll be in a better position to address that once we have a full accounting for what happened. And if there are any residents that are feeling ill, as we would always advise, they should seek medical care.
Questions from Alex at the Daily Line. First question. Yesterday, you said the city would pursue regulatory sanctions against Hilco. Could you go into more detail about what kinds of sanctions are on the table?
Well, once we understand the magnitude of what happened, I mean, at a minimum, as I said yesterday, they violated a provision in the code that talks about not having particulate matter wander off-site. So that's a basis for citation. We're now learning more things today. I can't quantify what those violations are going to be, but we're looking at every tool in our toolkit, and we will respond appropriately. Suffice it to say, we're not happy with what happened. It shouldn't have happened. And there were steps that they could have taken on Saturday to make sure that it didn't happen. They clearly failed to take those steps, and they will be held accountable to the full extent of the power that we have.
Second question. Would you support potential city council action to rescind the $19.7 million tax incentive that Hilco was awarded for the project last year?
I don't know that there's any basis for taking that kind of action, but as I said, we're reviewing everything. I will say that in my conversation with the CEO of Hilco, he was embarrassed and contrite, which I would have expected, and has committed to full cooperation with us to get to the bottom of this, which I appreciate, but of course, that's a bare minimum of responsibility that he needs to accept.
Question from WBZ. Has the city already done air quality tests in the area around the demolition site in Little Village? If so, what do they reveal, and can the public get details? If air quality tests have not begun yet, why not?
I'm assuming the question is with respect to since Saturday forward, and I will let Dr. Arwady address that question.
So the same day that the event occurred, CDPH had inspectors on site working to collect residue and dust, and those samples are already in the lab. It does take 24 to 48 hours at a minimum to run some of those chemical analyses to have the validation, but I would expect to have some of the results from that first day in the coming days. Related to the air sampling, so I want to be clear that there are a number of different types of air sampling, and we are actually working on all fronts to really be as aggressive as possible related to this. So first of all, folks may know that there are some air monitors in the area through something called Purple Air, which is actually a way of having a monitor that can be at an individual's home that can monitor things like particulate matter. And so the city has actually worked to purchase additional of these Purple Air monitors, and then we'll be working working through the alderman's office to ensure that more of those are installed in appropriate places throughout the neighborhood. That allows us to have sort of some ongoing level of monitoring related to particulate matter. In terms of what exactly the content and the substance are, there's a few things that we're pursuing there. So one, we are planning today to actually have a way to do some collection on site as a sort of a one-time test where you sample what's in the air and then you're able to bring that back to the laboratory. And again, it takes a couple of days to get that chemical analysis done, but I would expect some preliminary results from that in the day to come. But really at the end of the day, the ongoing sort of real-time air monitoring that we're the most interested in, particularly I think as you're looking ahead, right, on this site and in this area. That is not something that the Chicago Department of Public Health, we don't do air monitoring at all under typical circumstances. And so we have already been talking with the Illinois EPA, and in fact, not just the Illinois, but the US EPA about this situation. And our understanding is that there will be air monitoring in that more long-term way installed. So CDPH will be working to fill in this sort of, in the way that we have the technology to do it, with some of that more longer term, hopefully coming online. And then the last thing I'll say is that I think we will also be really pushing on Hillco itself around some air monitoring and costs thereof to ensure that they're bearing it. So lots of work happening on that front, and I expect over the next few days that we'll start to be able to have some results to show.
Question from Univision. As a lawyer, do you think the neighborhood residents have a case if they want to sue for damages?
I'm not going to take that question. That's really would be woefully inappropriate for me to respond.
Question from Shia at Politico. Mayor, is there an alternate plan for the Chicago casino, and what issues are taking a back burner with the city council as we continue in this COVID-19 world?
Well, the casino is a state matter that has to go through the Illinois General Assembly, which, as you know, hasn't been in session. So the plan is to go forward, but we can't go forward until the Illinois General Assembly is back in session.
We have a few questions from Shruti at Bloomberg. What is your perspective on who has the authority over stay-at-home orders? Is this a state or local decision, or something that can be decided at the federal level?
Well, the governor has issued the stay-at-home order, but the actual implementation of that obviously has to be done at the local level. And certainly enforcement is left to local municipalities to implement. I don't know that the federal government has the ability to impose a nationwide stay-at-home order. However, where they could show leadership, which they have so far been unwilling to do, is to give the kind of guidance that would in effect be a mandate of stay-at-home. We still have way too many states that have not issued a stay-at-home order. I'm very concerned, for example, about Iowa. We have people that go back and forth in the state of Illinois between Iowa all the time. We have college students, for example, that are from the Chicago area that are had been at colleges in Iowa, and while those colleges are all doing remote learning, there are still students that are living in Iowa. I just think that we are never going to be able to move forward as a country unless there's some uniformity around these stay-at-home orders, a baseline that should be there, and that, of course, should be coming from the federal government. But in the void, we can't wait. So that's why Governor Pritzker rightfully stepped up to fill the void, and we've been doing our part to make sure that order has real resonance here in the city of Chicago.
Follow-up from Shruti. Does April 30th still look like the last day of the stay-at-home order in Chicago?
I think that's going to be difficult for us to say April 30th, everything comes up. I don't expect that to happen. I think that it will extend beyond that. And we are already in the process of thinking about even when we get to a point where we feel safe from a public health standpoint, what will be the sequencing of lifting that stay? That's a conversation, of course, we need to have with the governor and his team.
Last question from me for Dr. Arwady. It's from AD Quigg at Cranes. Are there any particular hotspots aside from the Cook County Jail that you are monitoring closely? For example, nursing homes, shelters, polling locations, etc.
Not polling locations, but the congregate settings certainly. So
The election's over.
yeah.
I'll let her know.
So
But she forgot.
So we have, yeah, I mean, definitely, I mean, like we were talking about, that's actually back to an on-topic question in some ways, especially congregate settings. So in shelters, in our long-term care facilities, certainly we're helping to support at the Cook County Jail, although it's not our primary jurisdiction. We have major concern for spread in those settings, and we've been putting a lot of resources trying to do creative problem solving, as you heard from the group here today. Similar work ongoing, I think especially long-term care facilities where there are a lot of people who are either in that older, over 60, if not over 70, 80, 90, or even beyond, and then the folks who are younger tend to have serious underlying conditions, that where we see cases, and we see many cases in long-term care facilities, it's a major priority. It's why the city's put PPE out into all of our long-term care facilities. It's why we've been doing a lot of aggressive both outreach and then individual sort of assistance as cases are detected in those settings, and it remains certainly a high priority.
I have two more questions, if you'll allow. One is from my colleague, Lauren Victory at CBS 2. If non-essential demo construction is halted, what does it mean for condo construction happening across the city, including facade work and in-unit renovations? We've heard several noise and dust complaints while people are at home.
Well, I asked the building commissioner to put a halt to demolitions across the city for this week so we could get an understanding of what is in tap. I wanted to make sure that I understood whether or not, for example, there was any other demolition called implosion. So I want to make sure that we take a pause in light of what happened on Saturday so we can understand what is on tap not only this week, but also for weeks to come. So we're studying that now, and we'll have a better sense of what's what. I don't see a world in which we shut down all construction, but I think we have to be thoughtful and careful in light of what happened, more careful in light of what happened on Saturday. So that's why I've said, let's just push pause for a while, let's figure out what's in the pipeline, and then we'll make a call on a case-by-case basis of what's going to be permitted to move forward.
And this from my colleague Marianne Ahern at Channel 5. What is your reaction to more letters that are going to be going out today regarding the election that is over, that poll workers have contracted COVID-19, and these letters will warn voters as well as other poll workers that this has occurred to make them aware? And again, do you think the election should have been postponed?
Well, look, the governor made a determination that the election was going to go forward. So that's, and given that, we worked to do everything that we could to make sure that the election went forward, but did so safely. As we talked about at the time, a number of the election judges typically are often seniors. They are sometimes people with underlying conditions. So we worked with the independent Board of Elections to ask a lot of tough questions on how they would actually address this issue and to provide supports both on polling places, social distancing, and election judges. But coming out of this experience, what's very clear to me is we cannot have a repeat of what happened on March 17th, meaning we have to put in place every measure that we can to really place an emphasis on voting by mail. It works well in other states. We saw historic numbers this time in this election. It doesn't make sense for us to go back. November seems like a long time away, but it'll be on us quickly. So I'm going to urge the independent Chicago Board of Elections to start working on plans to see that we can really emphasize both vote by mail and early voting, and emphasize social distancing and the kind of cleaning practices that they put in place. We've got to have an election. We want to make sure that people are exercising their civic duty, and voting is one of the highest expressions of that, but we have to do it in a way that keeps people safe and mindful of the experience that we're now having and will still be lingering with us in some form or fashion when it comes to November. So we've got to get on this now. It's a high priority for me to push the Chicago Board of Elections to make sure that they've got a better and more robust plan for November.
Can I just add? The other thing is I would say is that the longest time that we consider an incubation for coronavirus, meaning the time when someone was exposed until they might develop symptoms of be sick, is 14 days. In most cases, that's about 5 days. And so I would not have concern about something that occurred more than 14 days ago, having leading to infection at this point.
Thank you.